Hey y'all, my name is Katie Buds. I'm a physical therapist and former collegiate basketball player, and I am passionate about helping basketball players stay injury-free all season. I'm doing a mini-series on the top 5 injuries I see in basketball players, and today we're going to be talking about patellar tendonitis. So what is patellar tendonitis? Here, in our picture here, we have our knee joint. Your knee joint is made up of your femur bone on top, your tibia bone on the bottom, and your patella or your kneecap right in the center there. And so your knee joint has a lot of tissue on top of it, so we're going to add our muscles here, and then also connective tissue, which is your tendons and your ligaments. So we have our knee joint here. What happens when you have patellar tendonitis? You start to have knee pain right at the front of the knee, just below the kneecap. So this usually happens a lot to basketball players because it happens with repetitive jumping, landing, changing directions, squatting, and that sort of thing. And that's why patellar tendonitis is also known as jumper's knee. Just a side note there. But what happens during patellar tendonitis? So your patellar tendon is right here. It connects your kneecap to the front of your tibia here. And so when your quad muscles up here aren't doing their job properly, a lot of pressure gets put on to that patellar tendon. And so that patellar tendon happens to take all of the load while you're playing basketball. And so it gets inflamed, it might swell up a little bit, and it becomes really tender to touch. And so you usually feel this pain right in front of the knee, below the kneecap, when you're playing basketball and you're engaging in those jumping and landing activities that are forceful on that knee there. But you usually don't feel pain when you're just sitting or at rest. So that's basically what's going on, is that tendon in the front there, the patellar tendon, is getting overloaded, and it doesn't like that. So what can we do about treating patellar tendonitis? What we have to do is a multitude of things, but most importantly, we can strengthen the quad muscles up here. Okay, so we're going to strengthen them up so that they function more properly and do their job so that they take on the load, because they're a big, bulkier muscle compared to your tiny patellar tendon in the front of the knee there. So strengthen up those quads. You could do that. What we say as PTs is the best way to do it is eccentrically strengthening. So you're going to strengthen your quads as they're in a more lengthened position compared to when they're shortened. And then the second thing you could do is really strengthen up your glute muscles, your butt muscles, because they're one of the biggest muscles in your body, and they help support your hips and in turn help support your knees so that there's less pressure on your knee in the front there. Okay, so take on those 2 tips, see if that knee pain in the front gets a little bit better, and comment below with any questions you may have. I'd love to hear from you. Thanks guys, and have a great night.